You are eager to move and feel like an athlete again, but you're afraid to because you've been given misinformation, outdated recommendations, flat out lies, all the things that we like to call the nope.
In this series, we will debunk the nope, transform it into hope, allowing you to reclaim your birthright of healthy and athletic.
Don't forget to subscribe and share so that you and your friends are not missing out on any of this content. We want you to become a lifelong athlete. Let's get to it. Brandy, what's today's nope?
If my knees cave in, that means my ACL is gonna tear.
Oof. It's a recommendation / thought that we see all over the place that if we have dynamic knee valgus, the ACL is going to rupture. But research actually shows that knee valgus is a result of an already torn ACL, not the causative factor of it. Instead of fearing knee valgus, we should start to look at it as maybe we should be a little bit more exposed to hip internal rotation and valgus loading to prep athletes for their particular sport. One way that we can do that, we're gonna go ahead, Brandy's gonna use the squat rack to help her get into a squat, and she's gonna dump her knee into internal rotation. We're doing this at a very low load. We're just saying it's okay for the knee to have this different amount of freedom that we can move through these, because when she's playing in her sport and she goes to get tackled or goes to make a cut, she might be in some of these positions, so we might as well expose the system to it. Another thing that we can do is a Copenhagen. We can look at the medial knee structures, not just the MCL or these passive restraints like the ACL, the MCL, but the muscle groups that actually create tendons that give us active restraints. So Brandy's doing a Copenhagen to strengthen that inside part of her adductor, getting a little bit into the quad, but hitting these major tendons that go through the medial knee to give it more support. And then lastly, and the most important thing, is that you're training for what your sport requires. Injuries happen when you push your tissue to a threshold that they're not accustomed to. For example, if you're a defenseman in lacrosse, you're running about 2.2 miles per game at 85% of your max heart rate. Does your training program reflect that load that you're going to be taking on? If not, you're not just set up for potential ACL injury, but a whole host of other injuries. Now, Brandy, does this mean that we're going to completely get rid of these ACL prevention programs? No, because they've actually done a pretty good job. But what we are going to do is start focusing on strengthening the entire system and having more exposure to the movements that athletes are going to be facing, and not being afraid of every time the knee goes into a little bit of valgus, because knee valgus does not create ACL injuries. The ACL is already torn. The result of the torn ACL is then the resulting knee valgus. Again, you can look at this research article to learn more about that.
And if you have heard this nope in your lifelong journey of being an athlete, it's time to turn it into hope. We are here to empower you to get out of the nope, replace it with hope, and help you to reclaim your birthright of healthy and athletic.
In this video, we busted some myths, updated your education, showed you some of our favorite movements, external loading, but at best, that's only half the equation. The other half is internal load, how we adapt to it. We don't just specialize in movement, but how we actually adapt to it to become lifelong athletes.
We can't wait to coach you if you're interested, so head over to hopenotnope.org and we'll see you there.